Diabetes is literally 15 years after the first sign of dysfunction emerges. So we are trying to intervene at the pre-inflection point before there are other manifestations of critical disease. I'm Dr. Damon Tanton, and I'm the Executive Medical Director for the Metabolic Health Institute, and I've been with AdventHealth for 18 years. AdventHealth is a multi-state hospital system, and our mission is to meet patients where they are. And so the Metabolic Health Institute allows us to engage with patients early on, especially when they're dealing with what we call pre-disease, like before disease. So it's definitely a preventative mission. My vision is to basically change the paradigm to make disease optional. Whole person care should be an obvious goal, but it hasn't been in healthcare. And so it's putting substance behind the theory. What we're trying to do in Metabolic Health Institute is treating the physical, treating the mental, treating the psychological, the emotional, providing support for the person, not just the patient. That's difficult to do, and it takes a big team, a dedicated team, to accomplish such a difficult mission. When someone develops quote unquote diabetes, we say, oh my goodness, you need to do something about that. But that's not the answer. The answer is, oh my goodness, we should have done something about it 15 years previous. So we're trying to define the story to raise awareness that all of this is preventable and optional. And so I think it's difficult, but if we're able to redefine that paradigm, it will fundamentally shift the level of health in our world. The biggest barrier that I've seen for patients is a misunderstanding of what causes the disease. Unfortunately, most patients blame themselves and view it as a purely behavioral issue. But now we know that there's much more physiology behind it. It's not a psychological thing. And just telling patients that, you can see the relief in their face. And it's so important for patients to understand the why. Once you understand the why, most of the challenge has already been surmounted.